Good evening, I'm Hartford Healthcare's Tina Varona. Thank you so much for joining us for another live Facebook discussion. Tonight's topic, we're talking about digestive diseases, digestive disorders. They affect millions of Americans. We're going to talk about them all, from irritable bowel syndrome to bloating to acid reflux. We're going to tackle them all with Dr. Neil Parikh. He's a gastroenterologist right here at Hartford Hospital. Dr. Parikh, thank you so much for spending some time with us tonight.
Thank you for having me.
So what is the most common, maybe top 3 or digestive disorders that you see in your practice?
I would say, the most common that I think affect each and every one is irritable bowel syndrome, acid reflux, and of course colon cancer awareness and screening.
Yeah, and in March we are coming to an end. It is Colon Cancer Awareness Month, but still doesn't mean to not be aware of colon cancer and its effects. There's an interesting study out by diet in terms of eating fruits and vegetables and eating fish can actually prevent or help prevent colon cancer, which I found interesting. Talk to us about that.
Yeah, so this is something that we've always thought, and there's always been, at least in the background, studies, associations that, eat healthy, be better. But I think now we're starting to get more and more concrete evidence on a molecular and genetic level, which is fascinating. So one of the studies that just got published last month actually, looked at a big cohort of people, and they showed that if you have a diet more rich in fruits, vegetables, and fish, for example, you have a lower incidence of colon cancer, especially the lower incidence of the molecular basis behind colon cancer.
Yeah, do we know specifically the compounds or the ingredients in fish or fruits and vegetables that are allowing this to sort of happen?
There have always been talks about, antioxidants, and I think there are a lot of notions and theories behind it, and I think on some level we do know specific compounds, but I still think we are not there yet in knowing what combination of food. And I think a lot of that is because I think each of us are different. I also tell my patients, you don't follow a textbook perfectly. And I think our underlying, whether it's genetic or environmental background, accepts the food and diet differently. And I think that's why the whole challenge has been, it's hard to be like, okay, well, if you eat this, this, and this, you'll be fine.
Right.
Because we're all different at baseline.
And genetically, we're all made
differently
as well. So, and that plays a huge role in it. We're talking to Dr. Neil Parikh. He's a gastroenterologist here at Hartford Hospital. We encourage you to ask Dr. Parikh a question while he is here, and he'll do his best to answer those questions. Of course, we can't give you medical advice, but we will do our best to answer your questions. There is also Dr. Parikh will be participating in a Walk to Wellness. This is Hartford Healthcare's monthly series at West Farms Mall, and he'll be there on May 2nd at 8:30 in the morning, so you can join him on a healthy walk throughout the mall and ask him questions there as well. So we encourage you to ask questions tonight, and we'll do our best, like I said, to answer them. So there's many GI-related illnesses and conditions that you see, and you were talking about irritable bowel syndrome being one of them. What do you say to folks that it's such a common condition? How do you treat that condition?
Well, I think the term is thrown around a lot, and I think we're all guilty of, all diagnosing ourselves or each other with irritable bowel syndrome at some point. And I think the most important thing is, and I tell patients in the least medical jargon way, of what I think the components of irritable bowel syndrome are, or what are the kind of theories behind leading to it. The definition just means a change in bowel habits with abdominal discomfort or pain for an extended period of time. But to me, I tell people that I think there's a food intolerance there. I think there is a mind-gut axis there, or a dysfunction there. And I also tell people that normally your GI tract should just propel things forward. And I think with irritable bowel syndrome, sometimes, there's a little dysfunction there where maybe the esophagus is squeezing, but your small intestine isn't squeezing at the same time, for lack of less scientific terms there.
Yeah, and this is, again, where I think people need to pay attention to their bodies and notice, like in terms of bloating, notice that when this is happening, what food, if you're eating spicy foods, if that plays a role, and sort of maybe keeping a diary and really paying attention to when these symptoms start, what were you eating? Because that could play a role, right? Exactly,
Tina. And again, a lot of my patients, by the time they've come to see me, they've already been keeping track, but I tell people either on your phone or take a notebook, keep track of when you have symptoms. What did you eat last? What did you eat 2 meals ago? And the key to that is that not everybody's going to follow the same dietary triggers. So I tell people sometimes it may be egg, soy, maybe spicy food, maybe garlic. I have patients who've told me it's strawberries. So it can be different things, but I think once you get to know what your trigger is, it goes a long way. And I think the other thing is that there's no, unfortunately, one magic treatment pill yet. I think it's part of because the symptoms are so, they overlap so many different GI conditions that what we try to do with different, medical options or dietary options or health style options is to try to pinpoint what specific symptom that patient is suffering from and then try our best to target that.
And diet does play a key role in in bloating, obviously, irritable bowel. It does play a key role. What should folks be doing? What should they be eating to maybe avoid these digestive issues?
Yeah, huge role. And again, it's hard to sit here and tell, a blanket audience, all of you should avoid these things. You can say common things. When you talk about bloating, common foods that cause bloating, some of the same things that we think are good for us with fiber compounds can cause bloating too. Broccoli, cauliflower can really cause bloating. Certain beans can do it. That's not to say to give that up completely, but to figure out if that's a specific trigger for you. Because at the same time, you want to have those vegetables. You want to have that fiber for your colon health as well, which is why it gets challenging.
Sure, yeah, because you're one thing you might be eating that's good for one thing, but could create a problem with something else in the digestive tract.
Exactly.
Let's talk about acid reflux. What are you seeing with that? Do you see that a lot in your practice?
Yeah, I see acid reflux all the time. And I tell people that it's normal for everybody to have acid reflux at some point. Most people, healthy adults, will have acid reflux probably once or twice a week. I think that's normal. That's expected. It's really when it happens more and more that we start to wonder and worry about other conditions that can be a manifestation or a consequence of acid reflux.
Sure. Okay, so we have a question from Millie. She says, hello, Dr. Parikh. We also have another question. What are probiotics? Do they really help with digestive health, and how do you choose one that's right?
Great question. It was Millie, you said?
Well, Millie said hi.
Okay.
That was another question.
Okay. So great question. Something we talk about and I talk about almost on a daily basis. So probiotics, what they are they're compounds. They're bacteria that have been generated in a pill form. There are probably a handful of them out there marketed, both pharmaceutically and through natural stores. And in general, it's not fair for me to say that one is better than the other for an everyday person. Okay, probiotics based on the principle that you have good and bad bacteria in your GI tract. Okay, specifically in your small intestine, where we really wonder about the good and bad bacteria. Probiotics are trying to reset that balance and give you the good bacteria back. The challenge with probiotics is that we don't really know what composition you particularly have, or when you're suffering from bloating or diarrhea, what has that composition, how that has changed. And so that's a challenge where some people will respond drastically well to probiotics and some people will not have much of a response.
And you often hear about yogurt as being a probiotic in certain foods. What do you say about that? Does that help? Does that work?
Definitely. So I tell people, and one of the biggest I think drawbacks sometimes of probiotics is the cost. Probiotics can be expensive. So I tell people you can get non-pasteurized Greek yogurt or non-pasteurized yogurt in general, and that can have similar, maybe not the same degree of the same composition, but have the same probiotic effect.
Yeah, so how can we maintain a good, healthy GI tract?
So I think the same things that we're told by our primary care physicians, by our cardiologists, by our endocrinologist, we're told eat healthy and exercise. I'm a big believer in the mind-gut axis. I think there's a huge close relationship. So I think things that keep our mind healthy, and that ends up being sleeping well, eating well, and exercise will play a role. And I think it gets tricky when we talk about eating well, because I don't know if we all fully understand what eating well is for each of us. Eating fruits and vegetables, like we talked about the study earlier, fish, those things clearly play a role. We just don't know if eating other stuff, how much of a disadvantage it is to our GI tract specifically. Like, for example, we know for cholesterol and diabetes, we know certain things right away, certain compounds will play a role. In the GI tract, we're still working on it.
Yeah, and a lot of folks probably don't, they have these conditions, but they don't get treatment for them, like bloating, it comes and goes, and they don't get it treated. Can it get worse over time, or how does that?
Well, I think the biggest thing is the challenge with GI symptoms is that they overlap.
Yeah.
So bloating can manifest as irritable bowel syndrome, as celiac disease, as functional abdominal pain, as a food intolerance, or as ulcer disease, or in some cases, less commonly, as more serious things like malignancy. So I think the important thing is not to worry as much about it getting worse or changing, but more to realize that it's important to seek evaluation because you want to make sure it's not any of the other scary things that can be treated differently. And then if it ends up being a food intolerance or irritable bowel, that's treated differently.
Mm-hmm. Okay, we have a question from Tanya, and she asks, do you recommend probiotics for Crohn's disease?
It's a good question. So I will tell you, one, what the studies suggest, and two, what I are personally advocating at least. So studies are equivocal. Mm-hmm. We have done studies, and this has been going on for many years now, looking at do probiotics make a difference for Crohn's disease specifically? And we don't know. The data is unclear. For ulcerative colitis, which is similar to Crohn's disease in some degree in terms of the bracket inflammatory bowel disease, there are certain populations, those who've had surgery for ulcerative colitis and have a pouch, certain probiotics have been shown statistically to make a difference. So it definitely helps. Whereas in Crohn's, we're still in the unclear zone. So what do I tell patients? I tell patients, there's doing a trial of probiotics, if that makes your symptoms better, then maybe your composition is being helped by that. But don't do it forever, and do it in a limited trial fashion to know if it helps you or not. But the data is not there yet.
Okay, good question. So we have another question from Rob. Hi, Dr. Parikh. I went to see my doctor about a possible digestive issue, and he recommended I start taking Zycophan for bacteria I may have in my digestive system. I've not done so yet, but I explained that occasionally I get an upset stomach with symptoms such as diarrhea after I eat. Is there anything I can do instead of taking the medication to start? Any possible suggestions?
Yeah, so great question. So he's referring to Xifaxan or rifaximin, which we are using for patients with both irritable bowel syndrome and bacterial overgrowth as well, which is in the small intestine. We talked about good and bad bacteria. And I think the key is that we keep coming back to the same topic of good and bad bacteria. And I think that's what I said to Denise as well. That's the fascinating part here. We just, are still just getting to learn what that really entails. I've used Xifaxan often as a 2-week course, mm-hmm. and it has worked for some of my patients. It doesn't work for everybody, but it does work for some people with bloating or irritable bowel syndrome. His specific question were alternatives to that. And I think alternatives go back to what we talked about earlier, is try to figure out if there's specific dietary triggers. Right. Try to see if increasing exercise or yoga will make a difference. And try to see if there is a mind-gut disorder. Do you feel like, or not disorder is not the right word, but dysfunction or increased axis? Do you feel like, the bloating happens more when you're stressed or upset or you're anxious? And I think picking those things up may be natural ways, different ways of getting by with the symptoms as well.
Yeah, some great questions, and of course, obviously, to check with your doctor, before doing anything alternatively or different than what we're talking about here. So we are talking with Dr. Neil Parikh. He's a gastroenterologist here at Hartford Hospital. He will also be participating in our Walk to Wellness. It's our monthly series that we have at West Farms. Hartford Healthcare has a lounge on the first level right by Nordstrom, and Dr. Parikh will be there on May 2nd at 8:30 in the morning. You can walk the mall with him and ask him questions there too if you'd like. Another interesting study that you and I were talking about, and this is for C. diff, or bacterial infections within the GI tract, and a stool transplantation. And that's exactly what it sounds like, stool transplantation. Explain that. It's interesting and might be a little disconcerting to some folks, but let's kind of set the record straight in what that's
Sure. So stool transplantation, or the more special term is fecal microbiota transplantation, is where you take donor stool and you introduce it to a recipient's GI tract. Okay, there are various forms of doing this. There are still being developed pills, but the traditional approach has been endoscopically, whether that's basically you take an endoscope or a colonoscope during a procedure and you introduce donor stool. And this has been shown very unequivocally for a condition called C. diff, or Clostridium difficile, which is an infection people get after they've been exposed to antibiotics and get a profuse diarrhea. And this has been shown by, again, I go back to the good and bad bacteria composition. The goal is to reset that bacteria composition, to kind of get you back to the naive thing. Because the whole theory behind C. diff is that when you're exposed to antibiotics, the antibiotics kind of destroy some of your good bacteria, and now unnatural or bad bacteria kind of overpopulate your GI tract and you get this infection. So stool transplantation, by introducing you with healthy stool, resets that. And it's been shown to work very, very well in C. diff.
And you were mentioning that could happen just one time and it could completely change the composition.
Exactly.
Right? Just one time is all it takes.
One transplant, and a transplant sounds like a fancier term, but one transfer of donor stool into the GI tract may be enough to reset your gut microbiome.
And again, C. diff is a common condition, a common bacterial infection that you do see a lot.
We used to always see it in people who were on prolonged antibiotics, but unfortunately we're seeing now more in just naive people in the community.
Yeah, sure. Okay, we have another question from Kathy. She asks, I was wondering why every time you eat, I have pain on the top of my stomach and my stomach, and it hurts.
So again, that can be a variety of GI diseases. Definitely would recommend seeing your primary provider or a gastroenterologist for it. But one of the common things, actually the most common cause of eating pain, which we call postprandial pain after eating, is usually acid related. So whether that's heartburn or dyspepsia is our term where there's acid indigestion, or it could be a sign of ulcer disease. All those lead to pain after eating. The other big category is your gallbladder. And when we think of traditionally you eat and you have pain, we think of your gallbladder, we think of acid, and we think of your pancreas. So again, it's very important. It's a great question, but one that definitely needs more investigation.
Absolutely. Okay, and then Tanya, back to the stool transplantation. She asked, does a stool transplantation cure Crohn's disease?
So again, like we talked about the probiotics, the data is not there yet. There are certain data that suggest definitely that it's going to make a difference, and other that say we're not there yet. So it'd be unfair for me to say that yes, it cures. It does not cure Crohn's disease, but I think there's going to be a role for it going forward.
Yeah, what is the current treatment for Crohn's disease right now?
So there's two schools of thoughts, but most current treatment involves various medications. We have medications as commonplace as steroids, and we have fancier medications that we've used traditionally for rheumatologic conditions that we use for Crohn's disease.
So what do you suggest to folks out there? Because obviously with the questions that we're getting, Crohn's disease, acid reflux, bloating, these are very common conditions that people live with every single day. How do you decipher what you may or may not have, and what do you do about it?
Well, step one is talking to people. You'll be surprised when you talk to people at work that a lot of people are suffering with stuff.
Yeah.
And the benefit of talking to people is that more likely than not, one of those people have now talked to their provider, which will hopefully lead you to talk to your provider, because that is the first huge step, is talking to your provider. Because there are certain few diagnostic steps we can do that pretty quickly can help differentiate the variety of GI conditions that all may have the same symptom.
But now some of these, bloating or irritable bowel syndrome, it's not a topic that people like to talk about and may not want to talk about with their friends or coworkers. So how do you sort of circle past that, and if you want to sort of self-diagnose, or, what should you do?
Well, I think the important thing is, when you go to see your primary care doctor, you mention the symptom. You mention the symptom, how little it makes it. I talk the same thing about constipation. I tell my patients, and I personally get upset, saddened by, I meet patients who've dealt with constipation for years and have gotten used to it. And I tell them, bring it up. And it's easy for me to talk about it because this is what I do on a day-to-day basis, but it may not be easy for everybody. But talking about stuff leads to questions and leads to answers. Because you'll be surprised that even things that may be like, well, it's just bloating.
Right.
It's not just bloating.
Right.
Suddenly, you're not going to restaurants because you're bloated. Suddenly, you're not going out to dinner because you're bloated. Suddenly, you're stepping out of a conversation because you're bloated. It's not just bloating. It's not just constipation. And I think a lot of GI illnesses, while they may not be necessarily scary signs, are lifestyle-changing signs.
Yeah, and I also think, too, that some people, they don't want to, confront it, so they deal with it because they don't want to talk about it, and you don't have to deal with it. There is help out there.
Exactly.
You can get treatment for it.
Exactly, Tina. There's two things. One, you don't have to deal with it. Two, you want to make sure nothing scary is going on.
Right.
So both reasons. One, you can feel better, and two, you can also feel reassured that you're all checked out.
know your body, listen to your body, and listen to your mom when she says eat those fruits and veggies.
That's true.
Right?
That's true.
Neil Parikh, thank you so much for joining us. And once again, join Dr. Parikh. He's going to be at West Farms coming up on May 2nd at 8:30 in the morning. You can walk and talk with him and ask him questions if you have additional ones that we didn't get to answer here. So once again, thank you for joining us. I'm Hartford Healthcare's Tina Varona. We'll see you next week.